All right, Dr. Jubril here from the Cherry Hill Free Clinic, founder and CEO of the clinic. I am here with Mr. Payne, who Mr. Payne has experienced the clinic as a patient in clinic. And one of the things I want to mention, because this here is really special, but one of the things is that labels aside, doctor, patient, one of the things that happens at the clinic is it's one human being serving another human being. It's a mission of service and hope. And in fact, one of the things I've shared with a lot of our audience and volunteers is that there was some point in time, one of the things that drives me to do this work is the fact that my father, as a recent immigrant here in New York, was uninsured for a while. So really, I say all that to say that I'm grateful to Mr. Payne for being here with me to share his stories. Yeah, Mr. Payne, I'm gonna open it up to you.
Okay. Yeah, I know that I didn't really expect to lose health insurance at the time. And just going through different things, life, going through divorce, things like that. So I lost the health insurance, trying to get insurance again. And I never saw myself in this predicament where I would need to have insurance.
Yeah.
And then I lose the insurance. And so now struggling to figure out what do I do for my health insurance because I have major health conditions, diabetes, hypertension, things to that nature. That was one of the things that I was like, okay, I'm trying to figure out what to do.
Yeah, and a lot of people, this is not unique to Mr. Payne. A lot of people go through these episodes, really, lapses in care. And it's one of the reasons that compelled us to in the founding of the clinic and in the volunteerism of our doctors, nurses, nurse practitioners, and PAs and the non-clinical staff. And so one of the things I want to go back to, Mr. Payne, is how were things when you still had care? And did you ever imagine at the time losing care?
When I had care,
Yeah.
everything was good.
Yeah.
And like I said, I never ever thought that I would not have health insurance. And I just never had that in my mind, never saw that.
Yeah, and how did you end up losing that coverage?
When I had got a divorce from my ex-wife, she worked for the state and she said once we got the divorce, that was it. And I struggled for a little bit, tried to get my own health insurance with Obamacare, but that still, some things happened, some glitches, and then I lost everything. And I was without insurance, just figuring out what to do.
And Mr. Payne, if you don't mind sharing what some of the more difficult, or perhaps even some of the darkest moments in dealing with not having access to care, because a lot of times people in the community, there's a bit of a misconception about being uninsured, and I think one of the reasons I'm personally grateful to you for, in this case, being the face of this, is that, and we try to message this in clinic, but just understanding that this can happen to any one of us.
Yes.
Yeah.
Again, my profession as an activity director, things of that nature, even as a pastor, everything was good. I was making good money, but lost to health care, and it does affect people. It affected me because again, I never ever thought that I would be without health care. And so even with knowing that I don't have health care, now I'm picking and choosing when do I go to the doctor, which doctor to see. All right, now my primary doctor, the copay. The copay is different now because now it's not free. Now I got a copay of $50 or $100, figuring out which specialist to go to. Because I used to go to a kidney specialist. So now I'm like, okay, let me reschedule. Let me pick and choose who I'm going to see based upon what money I can pay because I don't have the insurance. So it does affect.
Yeah. And the other thing here is to that point about having to, whether it's ration care or ration medicines or make really difficult decisions. And that must have been an incredibly difficult thing to just navigate, really. Yeah.
Because what happens is people are used to just getting up and going to the doctor. They get a cold, something happens, they just get up and go to the doctor. But when you don't have that available to you, now you have to rethink, do I need to go to the doctor? Is it something that I got to go to the emergency room?
Right.
And so you really are now drawing a line on
Yeah.
some things.
Yeah.
And sometimes it's a very difficult decision.
It is. I'm sure it is. And here's another one, Mr. Payne, is what was something you had to, that you loved to do, that because of not having access to care, that you had to either stop doing, or you and I talked about this a little bit ago, which is at the time, even having to resort to use the ER more often, right?
Yeah.
Even that it can be quite traumatic. But I just wonder what that might be. What were some things that you had to either stop doing or that you had to do because of lack of access to care? Yeah.
Yeah, one of the things that I'm grateful for the clinic was when I was sick and when things was happening, I was able to now go to the emergency room, and it gave me access to go to the doctors through your clinic.
Yeah.
And so prior to that, going to the emergency room was like, wait a minute, do I have the funds to pay the bill, because I don't have the insurance? So pick then you choose.
Yeah.
You had to figure out, and I'm gonna be honest with you, do I go to the emergency room because the emergency room bill is gonna be $300, or do I take the $300 and pay my light bill? Things to this nature. So you had to really figure out what were you going to do, the decisions that you had to make.
Yeah.
And it can put a damper on things.
I'm
It can
sure,
hinder what you want to really do with your family. So yeah, there was a lot of major decisions that I had to figure out and rethink.
Yeah.
Do I do this? Do I do that? And make that decision, make that call.
How'd you find the clinic? Yeah.
Funny thing about finding the clinic, it was through a coworker. She knew that I was struggling with finding health insurance. She knew my whole background, and when she told me about it, I said, okay, let me check this place out. And she says, right here in Cherry Hill. I said, okay. At first I didn't, but then I was like, okay, I gotta go. My wife said, you gotta go. She said, I'm gonna go with you. And so I called, made the appointment for the Saturday.
Yeah.
And that was it. And
Yeah.
I really do appreciate,
Yeah.
Cherry Hill Free Clinic.
So you were able to get in. How long did it take to be able to? You mentioned the Saturday. Was it like?
It was 1 week.
1 week.
It was 1 week. She told me about it.
Yeah.
I said, okay, all right, I'm gonna call them, all right.
Yeah.
But then the following week,
Yeah.
I called, made an appointment,
Yeah.
and I think it was that Saturday,
Yeah.
they said, we have an opening, you
That's
can
awesome.
come in, and I've been here ever since.
That's awesome. That's
Yeah.
awesome. And how has the Cherry Hill Free Clinic impacted your life? Would you say, Mr. Payne?
The Cherry Hill Free Clinic has saved my life. Oh my God.
Yeah.
I never knew how dangerous my potassium dropping, like in the 2.6, 2.7 levels.
Yeah.
I never really knew how dangerous that was. But it was through the clinic and everybody following up after blood work, things to this nature, that they would say, Mr. Payne, you got to go to the emergency room.
Yeah.
Mr. Payne, you got to do this, you got to do that.
Yeah.
And so I really do appreciate the Cherry Hill Free Clinic. And a matter of fact, what I do is, when people say, what's your doctor's office? Where are you coming from? You say, I don't remember. We say these things. I say, I'm coming from the Cherry Hill Free Clinic. Down in Cherry Hill, Dr. J is my doctor. And the team.
Yeah.
I'm not ashamed to make mention of the Cherry Hill Free Clinic.
Yeah, no, thank you, Mr. Payne. That's, I always take these moments to acknowledge just our incredible volunteers. We call them, as my board chair would say, our volunteer angels, we call them, because these are folks who is about 50-something doctors, nurse practitioners, PAs, MAs, EMTs, and then there's another 60-something non-clinical staff who volunteer and these are folks who often already have work a full week's worth of work, and often volunteering on the weekends. I'm struck every time because the place is now open. It's open right now as we're here sitting in front of clinic.
Yes.
This clinic happening. One of our volunteers is there
Yes.
seeing. We're probably going to serve about 45 people today.
Wow.
In the 4 exam rooms we have, and this is all powered by volunteers. It's one of the the missions that it really renews my hope in humanity that
Yes.
that people would do that. And yeah, no, but thank you
Yes,
for saying
yes,
and it's
yeah.
it's one thing for me to say it, it's another thing to actually hear it from
No,
you,
listen,
Mr. Payne. Yeah.
it's a beautiful program, and I would definitely, if I know somebody that doesn't have insurance, this is the place I'm going to send them. Even before they try to go, I would say, listen, I know a place. This is the place that you should come.
Absolutely. And that's one thing is we also try to navigate folks through coverage. We have some volunteer navigators who help make sure that, because the goal is to help people reconnect back to coverage. So like
Yes.
how you've done.
Yes.
And it's there when needed, and as folks are able to get back into insurance coverage, then we do that. But one thing I wanted to get back to
Sure.
here, Mr. Payne, is what would you say, what has improved the most since in your personal life, since being reconnected back to care? Yeah, what would you say has?
In my personal life, I really have been able to relax, been able to take it easy, like we are here today, just to be able to sit out here
Correct.
and just
Correct.
relax,
Absolutely.
breathe the air,
Absolutely.
take it in, and I couldn't do that before. And I know that the medical conditions that's going on with me
Yeah.
is causing me to take time off from the job, but I'm appreciative because I'm able to come here to the Cherry Hill Free Clinic whenever I need to, make my appointments, I get follow-ups, and it has helped me. It has helped me a whole lot.
That's a great point you mentioned, because I remember a lot of times I'm always floored by people, but because folks will endure, right? I remember a time when you and I talked and you were working full-time work while struggling with these health challenges, and just pushing through and pushing on, and the toll that takes on anybody's body, right? And so I can imagine that not having access to a provider to say, no, time out, we need to just, we need to give you some time to, just recuperate and heal. And I just, one of the things that drives me is, just this vision of a world where no one has, just suffers from lack of access to care, and whether that suffering be just, again, just pushing through, and just when all they need is a provider to say, hey, no, listen, here's what, take some time to just do that. And conversely, what's something special that you enjoy, again, that now that you have access to care, if it's different from what you already said?
The fact that I can come to the Cherry Hill Free Clinic and the environment is just really pleasant. It's so nice. I think we was briefly talking, when you go to a doctor's office, when you go someplace, you're looking for what's wrong. You're trying to figure out what's wrong. And I have not found that yet. And not that I'm not, and now let me just say this and let's set the record straight. I'm not looking for anything wrong anymore, all right? I completely know that everything is good because I see the heart of the people that's serving here. And that's what's important. When you know that somebody's here volunteering and they're serving people out of a compassion, that makes a big difference. It helps with it not just help with the medical aspect, but it helps with the mental, psychological, all that comprises of a person. It helps with the recovery. It helps with making sure that they are okay. And that's what I enjoy. That has changed me and helped me.
Gotcha. This is probably the last question, and again, thank you, Mr. Payne. But what would you like to say to Cherry Hill Free Clinic volunteers and donors who just help us make this happen?
I want to say thank you from the bottom of my heart. My wife wants to say thank you because of their service and their work and their sacrifice. I personally am able to continue to move on and go on. And again, I never saw myself here. I never saw myself this sickly. I've never been this sickly. But during this time, the Cherry Hill Free Clinic was here for me. And you guys helped me and are continuing to help me get through this tough and difficult time in my life. And if you really want to know how well we're appreciative of, When I tell my wife I'm going to the doctor's office,
Yeah.
she's okay. Just tell everybody to say hi. That's how comfortable she is.
Yeah, yeah.
And she's good with me coming here.
Yeah.
And so I want to say thank you for me, my wife, my family.
sir. Yes,
Thank
sir.
you
Yes,
for
sir.
your sacrifice and
Yes,
the
sir.
service that the Cherry Hill Free Clinic
sir.
does.
Yes, sir. No, Ms. Payne, you've been gracious enough to spend time doing this with me to share with our volunteers, our donors, the public. So one of the things about this work is just making sure that folks out there know that if you are in a bind, we are here for you. That's why it's here. It's for folks to have access to that care. No, really, I thank you, Mr. Payne, for being gracious
no
enough
problem.
to do this with me. And for our donors, our many donors, this work does not happen. I always say that this work, it's the community taking care of the community, right? It's the volunteerism of the volunteers, it's the philanthropy of donors. It's just all of that coming together so that if any of us are going through a lapse in coverage or a difficult time, that to know that we are taking care of each other. That's really the message of hope that really just warms my heart every time. And with that, Payne, anything else you wanna share?
I'm good. I'm glad to be a part of this organization.
Thank you, sir.
Thank you
you,
very
sir.
much.
Thank you.